Hello and welcome to this video, which is about providing a service user with a bed bath. So let's look at the equipment that we need to start. We're going to need a bowl of water to wash, 2 flannels, a dark and a light. So we have 2 flannels so we don't mix up infection control purposes. The light flannel for the top half, the dark flannel for the bottom half. So we always go from head to toe first. And again, same as the towels. We will need some body wash or a bar of soap. We're going to need some deodorant, either spray or roll-on. And again, we're going to need our universal infection control stuff. So our hand sanitizer, our gloves and our aprons. So let's start. We're going to wash our hands, bit in the middle. Do our hands, round the thumbs. We do the knuckle shuffle. And we're going to go round the wrists. By the time we finish, our hands should be nice and dry. We're going to grab our gloves and we're going to pop our gloves on. And we're going to take our apron. Before we start, it's really important that we gain consent from our customer or service user. So we're going to say to our customer, "Morning George, my name's Stephen. I'm here today to give you some personal care. Is it okay if I carry on?" And hopefully George will respond with yes. Now, he may say no, and that's absolutely fine. He has the right to say no. But we have a duty of care to explain what no looks like if he says no. So for example, George says, "No, I don't want personal care." I'm going to come back with, "Well, okay, George, but I must tell you, if you don't have personal care, your skin is at risk of breaking down. There may be sores, and actually I can't guarantee that you're going to be safe and well." He then gets the decision to base his response on, and therefore it enables us to gain proper consent. Now, George may not be able to talk, so therefore we can go for implied consent. And what that means is he may just nod. So he can't say, "Yes, Stephen, I'm happy for you to wash me," but he may nod. And if he nods, I can accept that as consent. Now, because we're on a nursing bed, it's really important we bring it up to a nice working height because I need to think of my back. So the first thing I'm going to do is hire the bed. Again, talking to George all the time. So George, we're just going to hire the bed up just so I'm at a nice working height. Now, sometimes at night, the bed might be slightly raised up. For personal care, you're going to want the bed to be as flat down as you can. So George, I'm going to lower the bed flat. Let me know if this hurts. And ideally, you need to get it as low down as you can. Now, providing personal care is probably one of the most intimate things you're going to do for your customer. And therefore, it's really important you think about dignity and respect. So before you start, just check around the room, make sure the door's locked, make sure the curtains are down, and make sure you have enough towels to cover their dignity and privacy. So that's the first thing. The second thing is, just imagine how you would feel if some random stranger walked into your home and started undressing you and giving you a bath. So bear in mind that this is a person that you're dealing with, and you need to gain trust and consent before you do move forward. So we've started a report and we're going to talk to George all the way through the routine. So at this point, I'm not going to talk to the camera anymore. I'm going to start talking to George just so you can see how the routine should be done. Now, we're assuming that George can roll and this is appropriate for one person. However, if George couldn't roll, it would be for 2 people. So, "Morning George, my name's Stephen. I'm here today to give you a bath. I hope that's okay." And he nods. Wonderful. So George, what I'm going to do, I've got some towels here. Now I'm going to pull back your covers, and as I pull back the covers, I'm just going to start placing a towel over the top. Okay. And you can see that I'm leaning a bit, meaning I need to raise the bed just a little bit more for a better working height for me. Now you can see I've taken the covers off, and yet the towel is fully covering George, so his dignity is being maintained. Now George, I'm going to wash your face first, if that's okay. So we'll get our light flannel. And I'm going to ask, George, do you want some soap on this? Because some people don't like soap on their stuff. I will assume he said yes. So we'll get a bit of the soap and we'll pop a bit on. Now, we're going to go around the forehead. So George, I'm just going to clean your forehead. There we go. And I'm going to take a fresh part of the flannel and I'm going to put my little finger under the flannel and I'm going to guide it just under the eyes so we can give good eye care. Okay, that's one eye. Now I'm going to clean my flannel, okay, because I don't want to, if there's any infection in this eye, I don't want it to transfer into that eye, so I'm going to swap hands. And again, good eye care. So I like to call them eye bogies, where the eye weeps and you end up with crusty bits, a bit like the nose when it gets blocked. So we want to make sure that they're free. And in the morning, the eye sticks. So it's really important that we gently wipe the eye and not pull it and kind of pull those bits out because it's really sore. Now, you will have also seen other videos on how to provide good hair care and good oral care. And at this point, that's what we would do. So we're going to dry his face. And George, I'm just going to dry your face. I'm going to go up. And again, we're just going to pat under the eyes and around the face. So at this point, I'm going to say, George, we're going to do your top half now, if that's okay. So we're going to pull back the covers. And we're just going to undo his shirt. Now, as we do this, I'm going to now put the covers back because I don't need to expose his body. He's going to be cold. We're going to take his arm and we're just going to ask him to bend his arm out. So George, if you can bend your arm. Wonderful. So that's the first arm. And what I'm going to do, I'm going to cover you back up, George, and I'm going to come around the other side. And I'm going to do the same here. So that's not nice. So again, we're going to ask him to bend his arm. And we're going to bring it up. Now, sometimes he might get stuck, his hand gets stuck. So if you take his hand and hold, you can slide it over. Okay, wonderful. So now we're out of the top half. And again, we can cover him back up. So if this were a lady as well, we've got her breasts and chest covered and nothing's exposed. We're going to take the flannel again and we're going to put some more soap on and we're going to now wash the top half. So we do one part at a time. We're going to bring the covers back. And again, I don't need to expose fully. I can work under the sheet. So if somebody did walk in now, they're not going to see anything. So his dignity is respected, or her dignity would be respected. Now, if it were a female, what I would have to do is slide my hand under the breast and lift the breast up using the back of my hand to clean under the breast line, just where it sweats, because we don't want any sweat marks. Okay. And again, we'll place down. We'll now rinse the soap off. Okay. And again, if it were a female, we'd lift the breast up and clean. And we'll pop the towel back. We'll get our towel. And we'll give a wipe. So at no point should my hands ever touch the body. There should always be a barrier between myself and the patient, be it a flannel or be it a towel. So there's no point for hand-to-hand contact. So Georgia's still covered up. And we're now going to wash the arms. And we'll ask George to lift. Now, obviously, what we could do is we could ask George to do this himself. I'm just doing this assuming that George can't. And we're going to go under the arm and give the armpit a nice clean as well. We're going to lift the hand, and again, you will have seen my video on good hand care, so you know how that should be done. We're going to dry the arm. Okay. Lovely. And again, place back. We're going to repeat the same on the other side. So, bring our towel and we're going to ask George to lift his arm. So George, if you lift your arm. So he could hold your hand, that's fine, but don't hold his, because if you hold his, you can end up with thumb marks where you're pulling. If you grab the wrist, you could bruise them, so don't do that. So he can hold you, but you don't hold him. So that's fine like that. Because if you start applying pressure to thin skin, you could bruise them. So under the arm and around. Wonderful. And then we'll give that a nice dry. Okay. Now, the top half's pretty much done, and at this point, it's our choice, or his choice, what he would like. So he may wish to have things such as talcum powder applied or deodorant. So I've got some deodorant here, and again, the problem with deodorant, it can be quite cold. So we'll undo it. Now, if you've got a roller ball, give it a twirl first, because you can see if it's not used, it dries out, and that sticks and pulls to the skin and it can get trapped. So make sure before you apply a roller ball that the ball rolls with your thumb before. Now, you might find, because of the aging process, that the hollow here and here is too deep for the roller ball to get in. So at that point, you could put a bit of moisture on your hand and rub it in. But we'll rub that on for George there. So wonderful. Now, the top half is pretty much washed. The only thing we haven't now done is George's back, so that's fine. We'll leave him there for a moment. We're now going to move down to the lower half, so that's the top half flannel, towel. We're now going to move down to the lower half, and what I'm going to do, I'm going to move this down and place a new towel across the top, keeping the top nice and dry, because I want the bottom towel for the bottom half. Now, we're going to ask George to bridge his bottom up so we can slide the trousers down. So George, could you bridge your bottom for me? Wonderful. And at this point, dignity is really important too. So you should be able to work under the towels and not expose any part of the body. Okay. Just pop those on the edge of the bed. So, George is going to be feeling a little bit vulnerable now because the trousers are off, and we're going to swap flannels now to the dark flannel. So we're going to wash the bottom half. Now, as we go down the bottom half, and I'm going to expose George for the sake of this training, but you wouldn't do this in real life, we're going to bring the towel across and we're going to look at the genitals. There's a couple of really important factors here. The first factor is we have a fold in our skin here and on our belly. Now those areas could get really red and sore and moisture will build up. So it's really important that we bring the folds forward and we get the flannels into those folds to clean. Once we've cleaned those, we need to make sure they're dry. So we bring the fold back and we dry. Wonderful, so we've got the folds and they're nice and dry. Now the next thing is, George is a male, so therefore he has a penis that needs to be cared for. No different to the lady who has the vagina that needs to be cleaned as well. And it's important that when you deal with the anatomy, and this is invasive techniques, that you gain consent. So George, is it okay if I lift your penis just to wash it for you? Now what I'm going to do is I'm going to use the back of my hand, I'm not going to grab, I'm going to use the back of my hand and just lift so I can get the flannel under and wipe and then cover up. We'll swap that over and again we go back, we use the back of our hands again, we lift up and we wipe. So we're going to go all the way around. What we're going to do, we'll dry, so again dry that. Now the problem is we've now got to look after the penis, because the penis becomes sore and again it will smell and it will cause an infection and bacteria. So what you'll need to do, if George can, you could ask him to pull back his foreskin, or alternatively you'll have to do it for him. So George, can you do this for yourself? and on this occasion he can't. So what we're going to do, we're going to take the penis and we're just going to roll back the foreskin, and we're going to take the flannel and wipe. And as we wipe, we go under the helmet to making sure it's clean and around the front. And again for the urethra, making sure that there's no discharge or anything coming out. And again, give that a wipe. And we can let that go down. We swap the flannel, give it a clean. And again, same thing. We lift, pull back and wipe. Now that only works if the gentleman is circumcised, because George is circumcised. So if they're not circumcised, you are going to have to pull back that foreskin to make sure it's clean. So again, we'll pull back and we'll wipe. Now, if this were a lady, then we've got to make sure that we clean the front part as well. And we need to be careful around infection, especially if they're doubly incontinent. And again, for the ladies, we would take our flannels, we could ask them to do it, or we would go in and we would wipe. Now, we go front to back, not back to front on a lady, because we don't want to get feces pushed into the vagina and causing cystitis, because they won't thank you for that. So again, we clean the front and then we clean the back. So, but you should be doing this all under a towel, so it's completely respectful. And also, the patient doesn't necessarily want to see it either, because they're going to feel uncomfortable. Now, once we've washed the anatomy, we can carry on and we can go further down the legs. And again, as we're going down those legs, we're looking for pressure marks, we're looking for sores, we're looking for bruises, and we're just making sure that their skin is in good condition. When we go down to the feet, it's really important we check the back of the heels as well for pressure marks, because what you'll find is that the skin will break down and you'll get a pressure sore here where it's against the bed. So again, we can lift that up and give the feet a nice wash. Again, we should be looking at the nails and making sure that the nails aren't overgrowing and they're not infected or sore. We're going to go down, use the rest of our towel and give George a wipe. Now, we'll repeat the same on the other side. So again, and you'll notice that I'm walking around the patient, not dragging the patient around for me. And again, here. So you can see, you don't have to have anything on show. Okay. So, George is now, front half is all washed. We now need to wash the back of George. Now, George is able to roll. Now, when we roll our patients, we need to do this as we would in the recovery position for first aid purposes. So we're going to ask George to take the furthest hand over to his face. We're going to get him to bring his knee up, and we're going to ask him to roll. Now, as he rolls, we're just going to drape the towels, so again, nothing is on show. Okay. So now the patient is laying on their side. Okay. Wonderful. So we've now got their back exposed, and at this point we can change the water. We'll swap it over, get fresh water, and we'll start again. Now at this point we've got the back, so we can fully see the back, and we're going to give the back a nice wash. And this is important that we're looking across the scapula and the clavicles and the shoulder blades, making sure that they're not sore or pushed against the bed or reddened areas. So we'll give them a nice wash there. Again, we're going to go down, give them a wash, and we leave them covered. We're going to swap flannels. We'll do the lower half. And for the sake of training, I'll show you the bottom, but you can see you don't have to have the bottom on show because it's all covered. But again, we give the bottom a wash. Now what we should be doing here is again using the back of our hand and lifting up the bum cheek so we can see the anus is clear and that there's no pressure sores. So here we're looking because This part here is prone to breaking down, and the coccyx part here is prone to breaking down. So it's really important we keep those nice and clean. So we're going to give that a nice wash, and again we can swap our towels and give him a nice clean. Now what you'll see is we've got all of their clothes, so we can tuck their clothes under, and if we had to do a bed change as well, we could do that as well, because they're on their side, so we can pull back the bed sheets. Okay. Now what I would do is I would get myself some antibacterial wipes, so we'll just imagine I have some wipes here. I would spray the bed and we give that a wipe so we can see the bed is clean. We get our clean sheets and we roll them up along the bed. So we're going to tuck in the new sheet. And you can see I've got that all nice and tucked in. What will then happen is we're going to ask George to roll back over. So George, if you want to roll back. So as he rolls back, we swap sides. Okay. And then George will be on this side. And again, keeping him nice and covered for his dignity. There. We can now go around the other side of the bed. And at this point, I can remove all of the dirty sheets and his clothes without harming him. And we'll put those in a laundry bag. I can now grab the sheet that he was laying on and just pull it through. So we have our clean sheet on the bed. And again, we'll just make sure that he's nice and clean and dry before we roll George back. So we can roll George back. So at this point, we've managed to give George a bed bath and wash him and keep him nice and dry all the way through. So all we have to do now is dress George. So we've got our top. So we should ask George for the choices of clothes. What would you like to wear? And we can bring George up for this. Come George. And we've got our top. So we'll put the first arm through. So again, put your first hand through. Ask them to take your hand and squeeze, so you can see I'm not holding, and just slide the top on. We're going to go up and over the head, so there we go, George, up and over. And I'm going to come round on the other side. Sliding the towel through, and again, same thing, just guiding the hand, getting George to take my hand and sliding through. Okay. We can ask George to sit up just a little bit and tuck down, and we can bring that t-shirt down and around. So the first towel's off. We're going to put some new underwear on George. So I've already got some underwear. So George, I've got some flamingos for you. It's all about the flamingos. So we're going to pop that on first. And we're just going to roll them up to the knees, because we're going to do this all in one go. We're going to pop the socks on next. So again, you'll see, roll the socks up lift the heel and roll the socks down. So again, we roll the sock up, we stretch it over the foot, lift the foot and roll it down. We'll get the cleaned trousers and same thing. We're going to slide his foot through. So we're doing it all at the same time. There we go. So that's your trousers. And on this side again, let's pop your trousers on. Okay, wonderful. Now, we're going to just loosen this towel up a little bit, so on one side, and we're going to shuffle the trousers, the shorts up, and again, nothing's been on show. We can slide the trousers up. Now, he's obviously going to be a bit uncomfortable on the back, so what we need to do is just ask him again one more time to roll over. So George will just want to roll you, and as he rolls, we can bring the pants up at the back and we can bring the trousers up. So he's not laying on a load of clothes. Now, once you've finished George, you're going to want to put a blanket on him just to finish off your routine. Now, what's really important is to make sure that there's no creases on the sheet because you don't want to make it uncomfortable for your patient. And again, you can just pop your sheet on top. And it's useful just to have one of their hands out so they can call the bell. So again, we should leave the remote control in their hand. Now, before I leave George, there's a couple more things that I want to make sure he can do. So first of all, there's a glass of water so he can have a drink if he wants to have a drink. Second of all, he's got his bed to move up and down. If there's a call bell system, he should be able to use the call bell system. And finally, just think, if I leave this room and it's going to be 3 hours before I hear or see somebody, will I be bored? So is there a radio that you can put on so he can listen to some music, or even a TV or some books? And finally, before you leave George, your final thing you should be saying to George is, George, are you comfortable? And is there anything else I can do for you? Once you've got that information and you're happy everything's done, you can take off your gloves and apron, and again, holding it all in, popping that to the clinical waste bin, and you're ready to clear up and go. So that's our video for providing a bed, bath and personal care in bed. Hopefully you found that useful, and please remember it's a combination of videos: hair, teeth, hands and bed bath, and watch the final one on pressure care and going to the toilet. Thanks for watching.